Welcome back. Well, when news broke last week about the apparent suicide of 27-year-old Wisconsin news anchor Nina Paholke, it was yet another unfortunate high-profile reminder of the issues surrounding mental health. Depression among youth and young adults is on the rise. And according to the CDC and the National Institute of Mental Health, nearly 46,000 lives were lost to suicide in 2020 alone. With September being Suicide Prevention Awareness Month, Kaiser Permanente psychiatrist Dr. Marcus Griffith shares what to do.
Doctor, thank you so much for being with us, especially as we engage in a topic that is so important. September is Suicide Prevention Awareness Month. How can someone be an ally or an advocate in the community for those who are suffering silently?
So the first thing is to not hold this so much as taboo. Lots of people fear that if you talk about suicide, it's going to make someone attempt suicide, where it's quite the opposite. So we have to be able to find ways to have open dialogues to discuss mental and emotional health.
Doctor, what would you say if someone actually has thoughts of suicide? We're not talking about somebody that is an advocate for them or maybe a family member or friend, but somebody themselves who might be watching. What can they do to get the help they need right now?
Yes, so right now is the time to get help. So fortunately, the federal government has recently authorized a new service that's very much like the 911 calls. And so we think about all the people, thousands and perhaps millions of people have been saved by 911.
Right.
Now we have a program called 988. So someone can call 988 and the phone will be answered by a licensed counselor who will then be able to intervene and find the help that someone needs right this moment.
It's so important, and I'm so glad that they're finally doing that and getting involved to really make sure that people are getting the help they need, especially these last few years. We have seen mental health crisis happening all over our communities. So this is so important, but I want to get back to a point you made about having that conversation. It's hard to open up that dialogue. So what do you recommend for us to do?
So first and foremost, it is a public health crisis. Every 10 minutes, a person successfully commits suicide. It is the number one cause of death for persons aged 10 to 35. So one of the things is this: it's not to dismiss suicidal thinking as something that is normal. So many times parents might dismiss, all adolescents are suicidal. No, that is not the case. That is a warning sign. So if someone does express those thoughts, get them the help they need immediately. You can use those phone numbers. You can also call your primary care doctor to have a conversation with your doctor about getting help, medications, getting connected with counseling. But the time to act is immediately.
And doctor, I understand that you actually had an early encounter with someone who committed suicide. I'm so sorry. I cannot even imagine what that's like. How did you handle it? And what would you say to someone who's encountered a similar situation?
So in encountering that situation is this: suicide is that thing, that untold problem that you will continue to struggle with the rest of your life if someone close to you commits suicide. So I was 18 years old. My track coach committed suicide at the University of Arizona at the track.
Oh my
God. And I know that moment was instrumental in me becoming a psychiatrist. And so to this day, still, no one really talks about what happened, how it happened. I know now, having gone back and talked to some people, that my coach had untreated mental illness, that he wasn't able to get the help he needed. And so that is really what this is about, is making sure that if you know someone who's talking about this, to encourage them to get help. If they won't get help, help them to go and get the help themselves.
Right. And we've talked about your coach and also others who maybe aren't expressing their need for help, or, they aren't talking about it. But what about those parents that have a child that's actually spoken to them and saying, I want to harm myself, I'm not feeling myself? What do we say to them?
Do not wait. You do not get a do-over. If your child commits suicide, that child is gone forever. And so it is easier to get the help for them now, to contact your mental health center, your pediatrician, to look on the back of your insurance card, to find out who your mental health provider is and get that help that you need. And of course, if someone has acute thoughts at that time, you can always call 911. You can call 988. Also, Georgia has something called GCAL, the Georgia Crisis Access Line, that someone can call that number 800-715-4225 and can get help at that moment.
Doctor, thank you so much for your advice, your expertise, especially coming from a place where you know and have experienced that type of loss. We so appreciate your time. Thank you so much.
Well, thank you so much, and thank you for bringing this topic to light.
All right, if you or someone you know is experiencing a mental health crisis, call or text 988 immediately. That's 988. And if you are uncomfortable talking on the phone, you can also text words to 741-741 to text with a trained crisis counselor for free. And we'd like to thank Kaiser Permanente for sponsoring that segment. All right, we're taking it to